Hi, I'm Dr. Jeffrey Marino from Bellissimo Plastic Surgery and MediSpa. Thank you for joining us on our Facebook Live. This episode, we're going to dedicate it to a topic that most people want to know about, but few are bold enough to ask. It deals with intimacy and plastic surgery. So Ella's going to ask me some questions that patients have written in or talked about, and I'll try to answer all of the questions you might have as well.
One of the most common questions that we hear in the office is how soon can I have sex after surgery?
It really depends on the type of procedure that you had, but for the bulk of it, I usually have patients wait about 2 to 3 weeks. And again, at that point, I tell the patient whenever she feels comfortable having sex, that's fine with me. The only one I would caution you to take a little bit more time is probably a labiaplasty. That's usually a minimum of 3 weeks, but the labia is mostly mucosa in that area, and so it tends to heal pretty rapidly. So again, I let the patient be the judge.
So it really depends on the procedure that they're having, and some have more downtime than others.
Right, and just their comfortability in doing it, and so some patients the swelling isn't as much. Some patients swell a little bit more. So it really just depends on how fast they recover.
What can happen if the patient is intimate with their partner too quickly after surgery?
I think if you wait, a minimum of 2 weeks, most of the time you'll experience some pain or discomfort in the area that you've had surgery on, and that will usually, have you stop what you're doing. I haven't seen anybody in my career that has done something where they opened incisions or caused problems more than maybe a couple of days of some minor swelling. So again, just be careful. I usually tell the patient, sort of be in control of the activity, and that usually once they're in control of it, that's usually not an issue.
Is there any sign or indication that that allows them to feel more comfortable with moving forward with intimacy, or is it just comfort level, really?
Yeah, I think it's both physical and psychological, and so with every surgery there are incisions, and so it really depends on, number one, physical. Are those incisions soft enough or non-tender enough, or the area is the swelling down enough that you can be intimate and not worry about pain or disrupting anything. But also the psychological part of it, it really depends on your partner. So I think people that have been with their partner longer are more apt to go back to having sexual intercourse earlier than somebody who does not have a long-term partner, because sometimes the patient is sort of hesitant because of the appearance of the scars. Scars go through a whole process, and I think if you've watched and tuned in before, we talk about the healing process, and as scars heal, they heal by scar tissue, and so for the first 6 to 8 weeks after any procedure, those scars are just going through a scarring process, and at the end of the 6 weeks, the scar tissue is pretty solid at that point, but the scars are usually a little bit thickened, and they still at that point are pink or a little bit purple. So from a visual standpoint, the patient may be a little worried about that. Even though we tell them they can cover it with makeup, again, it really depends on the emotional, psychological, and physical comfort of the patient.
Can you still be intimate then with stitches and drains or post-operative garments that they're wearing?
I don't have any problem with stitches. For the majority of things that I do, I use dissolving stitches that are under the skin so they're not seen. No one can really see them. I think if you still have a drain in, mostly after tummy tucks, arms, and legs, some of them are out within a week. The tummy tuck might take a week and a half to 2 weeks to come out. So most of the time that's still in such the early process. I doubt somebody would feel comfortable enough to have sex while that close to the surgery. As far as the garments go, if you're out far enough, you don't have to wear the garments all the time. And so usually after the second or third week, I have patients, they just use the garments when they really feel like they need to. But certainly I wouldn't expect you to have them on during sex.
Can breast implants pop with aggressive sexual activity?
I've never had that experience, but it is a common concern. So no, the breast implants are pretty sturdy, and they will take good amount of pressure. So that's not anything that you're going to have an issue with. In the healing phase, or even after it heals, your breast tissue will be a little bit more subject to pain or bruising with pressure or gripping or anything like that. The breast implants won't even be affected by it. And also for my patients, breast implants are always under the muscle. So again, if you're really not damaging the breast implant at all.
Is wearing lingerie something that may take time to wear again after a surgical procedure?
Again, depending upon physical and emotional. So from a physical standpoint, there is obviously a time of swelling and time of healing. So, especially after breast surgery, your breasts may not fit into a bra or in a lingerie garment, for the first 2 to 3 weeks, and then it would look better. But so in the first 2 to 3 weeks, you're probably not going to want to wear it anyway. But again, from an emotional standpoint, you've got to be comfortable with where you're at in the healing process. So I don't have any issues with anybody wearing a lingerie after surgery. It's just you're going to probably want to do it when your swelling is down and healed a little bit more.
Is there any place that should be avoided after surgery, like a hot tub or jacuzzi?
No, that's a great question, because I don't let any of my patients use a hot tub or jacuzzi for a minimum of 6 weeks after surgery. And that has nothing to do with sexual intercourse. It really is from the healing process. So in the first few weeks, again, there's not a lot of scar tissue, and you're relying on sutures to hold everything together. The heat from the hot tub can dissolve the sutures a little bit sooner, so I'm more worried about that. Also, hot tubs and jacuzzis can have a lot of bacteria in them, so I think you're more prone to have skin infections and incisional infections when you get in too soon. So after about the 6-week mark, when the scar tissue is done and completely in place, sometimes at that point, jacuzzis and hot tubs can actually help the scar soften and remodel. But that's, again, after the 6-week mark.
You mentioned sutures. Is it possible for other people, as you're healing, to feel sutures? I know you have patients come in sometimes with sutures popping out or...
Yeah, so I use long-term sutures that are dissolving, but they'll last a good 6 or 7 weeks under the skin. So with that style of suture, there are times that what is known as spitting. So when you run your finger along the incision, sometimes you can feel like a little splinter, and that's just the tail of the knot of the stitch. And so every time a patient comes back to see me for a post-op appointment, I'm always feeling along the incisions to see if I need to snip any of the spitting sutures. So yes, in the post-operative period, a partner can sometimes feel, they won't feel the entire stitch, but they might feel something like a little splinter, a little bit rough. You can just let us know as we're going, and we usually try to clean that up as we go. It's not every stitch that spits, it's a very small percentage, but it might be just 2 or 3, and they can spit up to even several months.
And the last question, is there any time a patient should consider stopping intimate acts of pleasure after surgery?
I think that if you are having, sexual activity and you start to feel uncomfortable, you start to have pain, you start to have a little bit of swelling, then yeah, at that point I would have you just discontinue it. As I think I said that before, is that you're sort of in control and you take it as slow as you need to. Certain areas may be off limits, some other areas might be okay. So, but you'll know your body, you'll know how you feel. So just take it slow and easy, and I think you should be fine. But if you do start to have excessive pain, then I would just stop, and usually that pain goes away in a matter of a couple of hours. Sometimes, when I tell patients when they're getting back to activities, even stuff around the house, working out, running, things like that, you might have some pain and it might take a couple of days for it to go away. So don't be alarmed if it takes that long. However, if you start to see excessive swelling, maybe some redness, problems with the suture line, then you need to call the surgeon.
I just want to remind patients that anything they have concerns about or questions, they should always feel comfortable talking with their surgeon. As you can see, you're pretty comfortable talking about a variety of subjects. So is there anything else you want to add?
No, I think if there's any other questions, I'm always happy to answer them. And, you should feel comfortable talking to your surgeon, as Ella said, and even things as, things like intimacy and anything like that, I think you should feel comfortable asking. It's not that we have never heard the subject, and we feel comfortable asking or answering the questions for you. So thank you for joining us. If there's any other questions, you let us know. I'm happy to answer them. But you can follow us on Facebook, Instagram, TikTok, Twitter. You have all these that I'm just unaware of. So, but you'll find a lot of information on our webpage as well. So we hope to see you soon.